Good evening, Bethel Park, and welcome to our second Live Well Bethel Park Speaker Series event. Tonight I have the pleasure of having Dr. George Frodden here. He's a chiropractor who was born and raised in Pittsburgh, Pennsylvania. He's been practicing since 1982, and he's going to talk to us about stenosis. Dr. Frodden, welcome.
Thanks, Chuck. I appreciate it. Tonight I want to talk to your listeners, especially any of them that are having difficulty with ongoing pain into the back, pain that may go down into their legs, and particularly the ones that are having difficulty moving and walking. This is a condition that really causes some pretty significant disability in older individuals. It severely limits their ability to walk, to function, and do things normally. So the good news is tonight I want to talk about a very new and natural program that's available for this condition. And it has an 85% success rate, which is tremendous. And it has the ability to not only help people to reduce or even eliminate sometimes the need of medication, to prevent the need for surgeries. And I think the most important thing about it is it can help them to restore their ability to walk, to function, and to just get about their normal life activities, which this condition very often robs them of. So it's a natural process. It's a very healthy thing. It's very safe, and there's no drugs, no needles, and no surgery involved with this whatsoever. So this is a new program that, in fact, we became interested in a number of years ago and got certified to actually be able to perform this procedures with patients. And we're really enjoying the benefits of this here. So I'd like to share with you just a little story, if I could, about why this is a passion, if you will, of mine. We, over the years, have always worked with a lot of older individuals, and watching people suffer with this condition and watching their abilities to function and decline has always been very difficult. Even though we could provide some relief and whatnot, as they age, they tended to have more and more problems. And I think one of the best example of this was as a family of patients that I had. And this goes back actually 40 years, if you can believe. I know you don't think I'm that old, but I am. And this family, it was a father and mother, and they had 7 children. And the mother and all 7 of the children had all been patients, and they would come to the office and were enjoying the benefits of chiropractic. None of them had this condition. The father would come with them, and he would bring them to the office and oftentimes sit in when they were being treated, and it was very pleasant, but he had never been a patient, and that's fine. And as the years went by, because I've literally treated this family for close to 40 years, as the years would go by, I started noticing that he was, not doing as well. He wasn't moving as comfortably. And he was having difficulty when he would go to stand. He couldn't stand up straight and some things like that. And of course, that's the things that I see in my office every day. So when I would see that, I would say, his name happened to be George also, and I would say, George, are you okay? And he would say, yeah, I'm fine, no problem at all. And so I would just kind of let it go. But as I said, over the years, it just kept progressing, and the difficulty became more and more obvious. I would finally say to him, George, I'm watching you walk, and it seems like you're really having a lot of difficulty, even just walking into the office. And he would say, you know what, I'm fine. It's okay. All I got to do is sit down for a second or bend over, and the pain goes away, and I'm good. And I said, well, I have a pretty good idea of what you're dealing with here, and I have some things I can help you with that with. And he'd say, no, I'm fine. All I got to do is sit down. I'm okay. The family then started coming to me and saying, he says that, but he's really not. And in fact, this is something that we see with a lot of patients with this condition, is that they start kind of explaining it away. Like the family would come to me and say, he won't cut the grass anymore, and he says it's because it's too hot, and he doesn't like his riding mower, and he doesn't like the push mower, but we know it's because he's in too much pain. And they would say, he used to be involved with the American Legion, and he was a officer and was real active and was always up there. And now he gave up his position and doesn't do that anymore. And he says it's because there's been a turnover of people, but the real reason is he has to walk 2 blocks to get in and go up a flight of stairs, and it's too painful for him. He's just not doing it anymore. And the list kept going on. And finally, I had asked him a number of times, and he had always said no, no, no. And the family said, it has nothing to do with you. It has to do with him. He doesn't like doctors. He's one of those people that just, wants to avoid doctors and at all costs. But we were just watching him decline and decline. And, it was getting worse and worse. And finally, one day he came in with one of his family members and was just sitting there, and he goes, "Hey, I'd like to pick your brain about something. I'm thinking of having surgery on my back here. I have this pain in my back. It goes down both of my legs. I have trouble walking. I can't do this." And I knew all of that already just by watching him. And he said, I'm thinking of having surgery. Well, this is not a condition that does well with surgery, not at all. And I explained to him why he's not really a candidate. And I also was a little bit familiar with his family doctor, who we had some conversations about him through the family about this, in previous days. And I knew that his family doctor had already told him this. And I said, "Well, what did your family doctor say?" And he said, "Well, he said the same thing you did, but, it's okay. I just want your opinion." So I told him. And in fact, I said, "Well, I'll do one better than that. If you would like, I'll set you up with one of the top neurosurgeons in Pittsburgh, and you can talk with them. You can just have a discussion with them and see what they have to say." He did. The neurosurgeon explained that in his condition, he's not a real good candidate to do well for these things. Unbeknownst to me, he was doctor shopping. And he was out trying to find a surgeon who would just do it. And he did find someone, and the surgeon told him, "You know what? You'll be a new man. We'll get you squared away, and you'll be as good as new." And, prior to the surgery that he did have, he had difficulty walking. He could walk about 50 steps before he'd have to step. And this isn't unusual for people with stenosis. That's one of the things. They can really walk very little. He was taking over-the-counter medication on prescription strength every single day, constantly. Didn't help him, and he said so. That's another thing that's very common with this condition, is the medication really doesn't work well, but they're afraid not to take it because they think things will get worse if they don't take the medication. And he was able to dress and take care of himself and do all those things, and he ended up having the surgery. After the surgery, he never walked again for the rest of his life without a walker. He was on constant medication, and it was on opioids and narcotics every single day to deal with the pain. He basically became incapable of dressing himself and to being able to walk around. He developed Parkinson's, Parkinson's, dementia, and diabetes. All of these things, which are complications of stenosis, believe it or not. This back condition actually can cause other things to come because of the sedentary lifestyle that these people develop. After all of this, he ended up spending the last basically 8 years of his life in a chair or in a bed. In the last 2 or 3 years, he was in an assisted living facility, total care, and wasn't able to do anything. And the tragedy of this is that it's tough to watch someone take this course of inactivity, if you will, when there are things to help them. But the other thing that's really tough about this that doesn't get mentioned a whole lot is the stress that this puts on the family. And, I got to witness this firsthand because this was my father-in-law, believe it or not. We watched this go on over a 20, 30-year period and just watched this decline. And, seeing what it did to his wife and to my wife and the rest of the family and the stresses there was really something that was just hard to deal with. And so when I found this program that actually offered not only better results than what we had been getting previously as a chiropractor for this condition, and not only that, but it was able to, as people age, be able to help them maintain the ability to function and move. We went and got a certification for this. In fact, I think we're one of only 3 offices in the state of Pennsylvania that are certified to do this. And it's something that we started doing, and I have to say it's very rewarding. So what I'd like to do, if we could, is just give you a little information about what stenosis is. The term stenosis just means a narrowing or a closing down. And the people who have had it or have been diagnosed with it, they've probably either had an MRI or X-rays or some kind of diagnostic show that shows how the spinal canal has narrowed and starts to put pressure. And
I got a question. Is that,
yeah.
how's it different than like having a pinched sciatic nerve?
Well, a pinched nerve can come from other things. It can come from a disc that's pushing on it. It can come from vertebrae that are out of alignment. It can come from tumors, infections, a lot of other things. This is to where the actual canal, they were born with a very narrow canal that kind of chokes off the spinal cord, and or arthritic changes and other things that occur because of degeneration tends to narrow the canal. Now, what's interesting about it is that, a few years ago when I was in school, and in fact, even today, most physicians are under the impression that this is caused by the bones or the disc material physically compressing the cord. But the one thing that never made sense about that is these people are people that get relief as soon as they sit down. I mean, they can be in excruciating pain and sit down, and 30 seconds later, the pain's gone, and they do fine. So if it were really the bone choking it off or the disc, it just doesn't disappear. It's still that way. And what the medical researchers really discovered just in the last decade, and it's still something that is becoming, common knowledge among practitioners, is this isn't actually just the bone compressing it. It's almost like a varicose vein in the spinal canal. You have vein plexuses, which are like groupings of nerves that surround the spinal cord. And when you have this narrowing, it can cause a varicose vein-like reaction. Anybody that has a varicose vein knows that when you stand up and you move around, that vein gets bigger and it starts to expand. And if you put your feet up and let it drain, it gets smaller and isn't as painful. What happens with this vascular condition is when they're standing and they're upright, if they stand too long or they try to walk, it causes a back pressure buildup and these veins start to engorge, and that's what starts to squeeze the nerves. And as soon as they sit down, it's like putting your feet up and it all goes away. So this is really a vascular condition, not one of the bone. And this is why, for example, the drugs, the surgery, and most things, almost everything in the past really hasn't worked because we haven't been addressing the right problems. So to understand this a little bit, let's talk about what are some of the symptoms of this. Well, lower back pain, leg pain are the most common. It can be in the back, in the legs, in the feet, or any combination of those things. It's very often on both sides, but it doesn't have to be. This is usually a patient that's over 60, but we've seen it starting in as early as around the 30s. It can happen very early there. The pain is characteristically worse with standing and walking, and is usually worse if they try to lean back or straighten up a little bit. That's why they're usually hunched over. Very often you'll see someone leaning on a walker or leaning on a cane. And the symptoms tend to improve when they bend forward or when they go to sit. They can vary with laying down, but that's very common with it. Now, this is a term that if you have it, you're going to notice there's a lot of people around you, but the public doesn't really understand the prevalence of this, of how common it is. This is actually a disease that causes more life limitations than congestive heart failure, chronic obstructive pulmonary disease, which is what we used to call emphysema. It causes more functional limitations in walking than knee and hip arthritis. It's the most common surgery spinal surgery after age 65, and the costs are exorbitant. The last numbers I saw were over $2 billion a year for just the surgery for this type of problem here. They estimate, studies that they're estimating that in North America, in the next 10 years, this is going to be involving about 25% of the population. It's a lot. And the reason for that is we're getting older.
The baby boomers.
Well, the baby boomers, but the population is getting older and older, and that's why. The burdens on this worsen with age, so the risk of disability and the severity of the symptoms increase with age. And one thing that this may sound like a negative thing, this is a progressive condition. Once it starts, it generally just continues to get worse. There are things to stop that and reverse it. That's what we're here to talk about tonight. But if left unchecked, it does get worse. This is also something that as you age can become more of a problem, and that's why it's a problem of aging. It's something that you don't see a lot of it out necessarily in the public, and there's really a good reason for that. Is a lot of these patients have gotten to the point where they don't leave the house very often. It's too difficult to go to the shopping center, although one of the common things you'll see is these are people that have to hang onto a cart, they have to lean onto a cart and walk around it in order to go to a grocery store or a shopping center, or they're using walkers or canes as a way of trying to do that. People who have this condition, they become a tremendous fall risk, which, as we all know, is one of the things that is very common that leads to premature death, as well as other disabilities, so falling and breaking a hip, so to speak. So there's a lot of things that go with this. One of the things I mentioned, and this actually all happened to, is some of the comorbidities. We've all heard lately about the comorbidities with COVID. If you are higher at risk, if you have pulmonary diseases or cardiac diseases and all of these things. Well, with stenosis, you're at tremendously increased risk for diabetes, congestive heart failure, COPD, Alzheimer's, dementia, anything that is associated with inactivity, because these are people that progressively spend years of their life sitting, because that's where they're comfortable with it. So it's something that it really creates a lot of problems for this. So why does this happen, or what are the main causes for it? Well, aging is the main reason for this, and this is why it's also increasing in its prevalence. When I was much younger, the average age when my grandparents were grandparents, the average age expectancy was 65. So people weren't living past this. Now we've added 20 years onto that life expectancy, so there's more degenerative changes that can come about from that, and because of that, it happens. Heredity plays a little bit of a role in this. It does tend to run in families that way too, but aging is by far the biggest component of this. Now, having said that, because we're all going to age doesn't mean you can't do something about it. The thing that leads to the disability and the progressive nature is that it tends to be ignored, and the appropriate steps to avoid that aren't being taken early. People just blame it on age. Or sometimes it's even worse. Sometimes they're being told by their doctor, you know what, it's just your age, just live with it. Or they're being told that, you have some arthritis, there's nothing we can do about it, just live with it. Or they're being given medication that's really not helping them, but they're still taking it, or some of the other things. So just neglect and allowing the disease to continue is probably the biggest reason for most people that they have that loss of function and mobility. And I know for my father-in-law, that was absolutely the biggest thing for him. The things that are being done commonly to treat these conditions, you could kind of break them up into, in the past, into 4 categories. One would be medication. Another category would be different types of injections, manual therapy, which would include chiropractic, physical therapy, things of those nature. And then there's also always been surgery. And all these things have been used for it. The research that's been done, and I had nothing to do with any of the research, has shown that these things, for the most part, are largely ineffective. Most of the oral medications that people take for these things do not improve their functional scores or their pain levels, and they certainly don't improve their ability to walk and or stand. Epidural injections and those type of things, for the most part, do not make a difference with stenosis like this. Chiropractic, physical therapy, things of those nature, they have their place and they provide some relief, but they're not really have been shown to drastically improve the function of these people and to be able to maintain that as they age. You may be able to provide some short-term relief, but over time they continue to degrade. And as we talked about, the surgeries for this type of problem just really don't work out well. In fact, the studies that they've done on it have shown that when people go through those type of complicated surgeries, which are very lengthy recoveries, 2 years post-surgery, their ability to walk and their pain levels and their functional levels haven't improved at all. So they've gone through all of that. And then the condition does contend to progress. So the problem with those things is that those are what we've been using up to now, and until recent years, there's really not been something out there that has definitively shown to be able to not only stop, but to be able to regain some of that activity and functional level in their life, to decrease the pain, to decrease or eliminate the need for medications and some of these other things, and I think most importantly, as we age, to be able to maintain that. There's a fellow by the name of Dr. Carlo Amendolia. He's from Toronto, Canada, and he's actually the developer of this program. And he's a very unique individual in that he is both a clinician treating people, and he's also a world-respected researcher. And those are two things that usually don't go well together. They're usually one or the other, but he does both. And he saw the problem of this many years ago in the patients that he treated and whatnot, and also in the research out there is these people who are having these stenosis problems have a progressive reduction in their functional levels, increases in pain, and they become less and less active, and nothing was really changing that course. And so he started looking at all the research out there saying there has to be some things that can help. And he would find papers or research out there that would indicate that certain therapies, certain exercises, some things in chiropractic, some things in physical therapy, some things in psychology, some things and other things showed some promise, but still none of them individually would work. And so he started theorizing that perhaps that if we start combining some of these little things that seem to provide short-term relief, we might be able to get a benefit that was greater and hopefully one that would be able to provide longer terms of improvement and be able to sustain that. So he came up with a program going through all of this. He called it his boot camp programs. He started this, and he set about and did research programs. He was published in the Journal of the American Medical Association. The study was actually republished and redone again, actually here in Pittsburgh at UPMC. And shown to be effective. In fact, this is a program that has an 85% success rate. So what he did is he put this program together. He started treating patients with it, and right off the bat, they started seeing a very high success rate in people almost immediately being able to walk further, having less pain. And so he was very optimistic about that, but that was really the first part of it that he wanted to do. He wanted to not only help them with this, but if it didn't last, if it didn't stay with these people, if they weren't able to maintain, it wasn't worth the point. So his first study was a year-long study, and what they found at the end of that year is that the patients who had followed through with this and done the program basically were able to still maintain those levels. In fact, at 1 year, they were still able to keep improving their functions and whatnot. The last I understand, the last time they've gone back and done a retrospective study, they're up to 5 years now. And so these original people that they started and ones they've done since have been able to maintain these results and for some of them to improve them over time for up to 5 years. So what's really exciting about that, Chuck, the average age of these people is 85 years old. This is not young people. So this is a population of people that would naturally kind of be declining, and they're showing that if they participate in the program, that they can do very well with it. What's different about the program is how he set this up. So basically he wanted this program to be standardized, and that's why you have to go through a program to be to have them certified to be able to perform it. It has to be standardized. He said, I've developed this, we know that it works, we've done the research, I don't want people changing the formula, I want you not messing with it. So he wanted to make sure that all the practitioners that do it follow the standard protocol for this. It has to be comprehensive, and what he meant by that is it's not just one profession, it's just not a chiropractic thing, it's just not physical therapy, it's just not emotional. He looks at all the different aspects, the physical, the emotional, the exercise, all these things be considered and are part of the program. And the last thing he wanted to make sure, because he is a researcher, he wanted it to be evidence-based. He wanted to be able to show through peer-reviewed journals and research unequivocally that this has a benefit and it's reproducible, and that the success rates that they're claiming are things that people can expect if they go through the program. So that's what's really exciting about it. So the program itself has 3 parts. Part of it is self-management. I akin what they do with this program to how we've changed diabetes treatment over the years. My dad was a diabetic 60 years ago, and when he was first diagnosed, the doctor said, "You do this, and come back and I'll tell you what to do next, and you do this." And the patient had very little responsibility or very little active role in their management of the condition. Now diabetes, the patient has an active role in their treatment. They understand their blood sugars, they understand how diet and exercise and all these things affect it, and they're taught how to manage their condition better. That's the same thing with this. There are things that people do that will tend to exacerbate the pain that's associated with stenosis. There are things that they can do to help themselves, and they start to understand these things so that they can change their lifestyle to be able to do more. There is exercise with this, and let me say this to you, it's a big part.
Right.
And this is something there's no getting around. I have a specialty degree in addition to being a chiropractor. I'm board certified in rehabilitation. And anybody that deals with patients and trying to get them to exercise know that it's not the most popular thing for people. People want to exercise, but it's not something they keep up with well. Well, with this program, it's non-negotiable. This is part of it. And you know what? The patients don't necessarily find it hard to do. They don't find it painful to do. They don't necessarily like putting the time in to do it. But the vast majority of these, when they start seeing the results that they get out of this, and what's interesting is these are people that have had these conditions for literally years and years and years, and the basic program is 6 weeks long. So they're showing an 85% success rate in 6 weeks of just doing that. In fact, most of our patients in 2 weeks are actually changing and seeing the changes that way.
That's great. What's the name of the program?
It's the boot camp program for spinal stenosis. And so that's what it is. The last component of the treatment has to do with some of the manual therapy that we do that's part of this. And this is the part that's done by the doctor. The doctor teaches the self-management. We teach all the exercises. The patients have to do them, and we do this together. So it's a comprehensive program that way. As I said before, the nice parts about this is this has been shown to be 85% successful. And if you maintain the program, because this isn't something that ends after 6 weeks, the doctor involvement, the more intense doctor involvement is in that first 6 weeks, but that patient has exercises that they'll be doing the rest of their life all the time. And so as long as they keep those things up and remain active, they're able to show that they're able to maintain those improvements, like I said, up to 5 years at this point. And there doesn't seem to be an end other than a lot of times an 85-year-old, we don't know how much older they're going to get at that point. So I didn't know if you had any questions or anything.
You hear of pro football players having to retire, mostly football players, because of the narrowing of the spinal cord. Is that the same thing as this?
Yes, it can be.
I will date myself. Tim Lewis, he played for Pitt back in the early 80s. And I remember he was with the Green Bay Packers, and him and Willie Gault hit head-to-head. And like 3 days later, he has to retire because one more hit to the head, or if he moves his neck wrong on the head, he could be paralyzed for life.
So that type of traumatic stenosis that can come from a fracture or some type of serious injury, that would probably be a little bit a different type of stenosis than what we're talking about here. This one is certainly brought on more by the degenerative process of aging. However, someone like that sustains a serious injury in their 30s or 20s, by the time they're in their 50s or 60s, that is going to be an advanced area of degenerative process, and it can very well lead to these type of things. Sure.
Yeah, okay.
Yeah. So that's why we work with patients. That's why we have this program to try to help people find the nature of what's going on with them and to try to discover actually is there things that can be done for them.
What are the first signs of that you may have stenosis?
Difficulty, I would say, ongoing back and leg pain that is making it difficult or more painful to stand or to walk. Those are probably the single biggest hallmarks of the condition that people start ignoring. And in the beginning, it can be where they could stand for an hour or two, but eventually they start having to sit. And so it's kind of deceptive in the beginning because someone might be able to go out for a hike for 2 hours, and it's not until that point does it get bad. Our average patient that we see with this has difficulty walking 100 steps. 100 steps, not even 100 yards. 50 steps is not unusual. 10 minutes walk is difficult. These are people that can make it from their car to Giant Eagle to lean on a grocery cart then, and they have to make it better. So that's how this condition goes from being a little annoying with walking to all of a sudden I can't walk at all.
Do you see this happening in, besides older patients, but does weight have a factor in this too, the pain level?
You know what? It does tend to accelerate the degenerative process, but this isn't a condition solely for people who have weight issues. Yeah. Weight issues, tend to complicate almost any type of weight-bearing or structural problem, and it certainly does here. But this happens with just as much frequency with people who don't have weight issues.
I can believe that, but if having the weight issue, does that make it worse, like the pain more? Because I know when you're overweight, it puts more pressure on the back, especially the small of the back.
Let me say it to you this way. The pain that people get with this is not low-grade pain. It's the kind of thing that they take 20 steps and they stop in their tracks and they're sitting down or they're going to bend over and lean on something. These are not, especially in the more advanced cases, these are not low-grade levels of pain.
So is it always in the lower back, or can it be in the upper back, the middle of the back?
For the stenosis can actually occur in any type of, in any part of the spine. This particular treatment in boot camp is limited just to the lower back alone. There are stenosis problems in the neck which have a completely separate set of circumstances, and this would not be appropriate for that. You can have problems in the mid-back. Those aren't as common, but this particular program and the things we're talking about is specifically for the lower back stenosis. So, yes.
Okay. And is that the most common stenosis, lower back?
Yeah, by far. Lower back problems are the more common, of all the spinal problems, are the more common area to be involved, yes.
What, besides stenosis, what is the most common things that go wrong with the lower back?
Well, you have everything from strains and sprains to ligaments, which distort the alignment of the pelvis and the lower back are some of the more common things. We could just label them under strain, sprain type injuries. You can have disc injuries. Those are very common, everything from bulging to herniated discs as well as degenerative discs. Those are all very common. And then you, of course, have tumors, infections, and other things that way. Those are less common, but certainly they do happen.
What would be the best way for someone to keep their lower back in good shape? We talk about keeping the heart in good shape and all the muscles and everything, but if your spine isn't in good shape or your spinal column or anything, then...
That's a great question. So I would say it's a combination of a number of things. It's a great question because it's kind of like, if you want to stay healthy, what do you have to do? For these type of things, remaining flexible and mobile is incredibly important. One of the things that is really interesting about dealing with patients who have this condition is they don't perceive themselves as being that inactive. But if you talk to their spouse or their children, they say, he spends the day sitting in the couch. He doesn't leave his easy chair. That's all he does. He doesn't get up. And if you talk to the patient, they'll say, oh, no, I've been up all day long. I've been doing this. I've been doing that. But they're really not. It's just kind of, they start accepting that immobility. So remaining flexible and mobile is probably the most important. Maintaining strength in the joints and in the bones. And then the thing that I think is the biggest death knell for a lot of people with this condition is they just hope that it's not going to get worse, but this is a condition that if you don't do something, it is progressive and it will get worse.
Okay.
So don't ignore the problems is the biggest thing. And you could say that about most problems. Yeah.
You shouldn't ignore any problem, but even for healthy people right now, being flexible is the biggest thing to help your lower back?
Well, I would say you can't separate any one of those things. So flexibility, mobility, strength, and not ignoring problems, all four of those
I-
would be like the things that you want to do. There wouldn't be one that's the best.
How do you strengthen your bones and joints? Is that mostly through diet?
Oh, no. No, it's through activity. So, for example, everybody's physical capabilities are different. For some people, just remaining active and being able to walk regularly, being able to have some form of regular exercise is very, very important. The benefits of resistance training, like weight training, have been shown to be effective all the way up into the 90s and into the 3-digit ages. So all of those things are things that people can do to maintain that. They just have to find out what's appropriate for them given their physical conditions and whatnot. But remaining active is incredibly important. Yeah.
It seems activity is the key to good health throughout your life.
Well, we define, part of how life is defined is defined as movement. And if you're not moving, you have less life. And so, absolutely. Yeah.
I can see that as I'm getting older, I'm kind of like, no, I don't want to do this, but I'm going to do it anyways because I know I have to.
Well, I think for most people, we have to be honest that the thought of exercising or doing something is not something that we relish and look forward to. There are people out there that love it and do it all the time. But I think, a good percentage of the population, it's not something that's natural for them, and it's a form of work. But the sad part about this is that by putting it off, so too many people get to a point where they've let it go to where it's too late. And then they find it too difficult to get back into activity. That's why you don't want to ignore these things.
I found, within the last year, my son joined Taekwondo.
Okay.
And he's like, Dad, why don't you do it with me? And I'm like, and now I've been doing it for about 6 months, and it's been great. I'm more flexible. My mental health is doing a lot better just because that activity is getting everything, my whole body moving and relieving stress.
Martial arts, yoga, a lot of these, Tai Chi, there's so many things out there. Regardless of people's physical capacity, there's something that they can get into to start promoting, themselves and trying to improve their quality of life.
Yeah, because everyone thinks martial arts is, hitting everything and doing everything. There's a lot of flexibility. There's a lot of stretching to it,
Absolutely. There's also a tremendous amount of work on balance. And like stenosis, but even aging oftentimes compromises people's balance. So if you're not doing things to work on your balance, you're losing it. It's the old adage, you don't use it, you lose it.
Yoga's great. I wish I would have someone would come up with the yoga class specifically for males because, there's stuff we want to stretch and, not do all the real crazy stretches, just keep the back and the, muscles limber for basketball. And it's like, I don't really want to stand on my head. I don't need to do that for basketball or whatever activity I'm doing.
Well, after the show, you talk to me because I know a bunch of yoga instructors. I can put you in touch with someone that could help you with that. Yeah.
I'm sure a lot of guys would like it.
Yeah, just something that they could do. Sure, yeah.
All right. Any other advice to keep your back healthy?
Well, what I wanted to say is, as part of what we do in the office, we realize that people with this spinal stenosis and who have been having these problems most likely have been down the road of having a lot of different things done to them and whatnot, and they're still having most of these problems. What I'd suggest is that if anybody would like any more information about this boot camp program, about what we have to offer, I can give them a couple ways of getting a hold of me. I think they'll put this up on a slide perhaps. Our phone number is 412-257-8090. And you can do one of two things. You can just call the office and tell them that you heard something from the Facebook, Bethel Park Facebook stenosis ad, or the program, and they'll give you some information. We can send it to you, or I'll give you some additional information about how you can come in. One of the things that you have to do to be involved in this program is you have to qualify for it. The doctor that put this together was very adamant about being able to maintain those high levels of success. And one of the things that is necessary to maintain those levels is you have to make sure that you're actually dealing with stenosis patients, and that's the main problem. People who have stenosis, because it is a condition of older age, also have other things. They have bad hips, they have bad knees, they may have some arthritic changes of different joints and so on. And so there's many things that can mimic this also. So if you try applying this program to someone that doesn't have stenosis, it doesn't work. And so they first have to qualify for it. And that's done through a comprehensive consultation history and examination. And we have a program to screen these patients to see if, in fact, they are a candidate for this. So they can either just call that number and talk to the office, and they'll get information about that. If they would like, they can actually text the word stenosis to that same phone number, and we'll get a text message back to them that we can forward some information to them so they can find out more about it that way.
Okay.
Yeah.
Sounds like an interesting program and should be able to help some people.
Well, I'll tell you what, we help a lot of people with it, and it's very rewarding. I love it. Yeah.
So you said there's only you and 3 other doctors, chiropractors
The
in
last I
Pennsylvania?
checked, there were 3. Well, this isn't limited to just chiropractors. Any physician or any type of therapist can go through the program to do this. This isn't a chiropractic specific program. I would say most of the people that I know are doing it are chiropractors who have a background in rehabilitation also. The last I checked, there were only 3 facilities in the state that were certified through this. So it may have changed. I don't know. I haven't looked recently.
Well, we thank you for your time tonight, Doc.
Well, I appreciate it. Thanks for having me. And thank you.
Thank you. Okay, Bethel Park, we will be back next month with our Live Well Bethel Park Wellness Series on nutrition. So we look forward to seeing you in November.